This is Dr. Wu here, and I'm with my esteemed mentor, Dr. Kim Butterwick. So it's my great pleasure today to offer a treatment for her hands. So Dr. Butterwick, what about the hands really bothers you?
Well, just as I've gotten a tiny bit older, the skin is thinned out and it's kind of loose, and you can see the veins and the tendons a little bit more than I'd like.
Great.
So I want my hands to match my face, and since Radiesse just got FDA approved for the back of the hands, it's a great treatment. I know it's safe and good, and I'm in great hands.
Oh, perfect.
With you,
well, this is a treatment that Dr. Butterwick actually taught me, so I'm very pleased to do this today.
Great.
Okay, so here we have the Radiesse, and we like to dilute the product so that it gives a more even kind of distribution within the tissue. So that's what we're doing here. And as you can see, it homogenizes very nicely with a little bit of saline. It's a very simple procedure. What we do, just kind of tint up the skin a little bit here.
And how long do you anticipate this will last?
So Radiesse lasts a good long time, actually, up to a year and a half, if not even possibly a bit longer in the hand area, but there's slight variation between people. And then, as you can see, there's a little bit of irregularity right away, but we ask our patients to make a fist, and then we just kind of massage the product nicely into place.
The granular dough, that looks nice.
Yeah, and there we go. So as you can see, just nicely kind of volumized, but still very natural looking, no lumps or bumps.
I like it.
That's fast.
Now I have to get my nails done.